Good afternoon. We're glad to welcome you to this very important Valley College Town Hall, providing information on COVID-19 vaccine. I'm Dr. Barry Gribbons, President of Valley College, and for this town hall, we have Dr. Keith Norris from UCLA Department of Medicine joining us today, as well as Larry Nakamura, Professor Emeritus of Biology here at Valley College. Dr. Norris will start off the presentation on COVID-19, and we'll follow it up with answering some questions that you might have. At any time, please type your questions into the chat, and after the chat, Dr. Nakamura and I will ask Dr. Norris the questions. First, it's my pleasure to welcome Dr. Keith Norris. Dr. Norris is the Executive Vice Chair for Equity, Diversity, and Inclusion in the UCLA Department of Medicine. He co-leads the Community Engagement Research Program for the UCLA Clinical and Translational Science Institute and NIH-funded COVID-19 California Alliance, a network of over 70 community and 11 academic partnerships across the state to improve COVID-19 knowledge. Dr. Norris, welcome, and let me turn it over to you.
Thank you very much, Dr. Gribbons. It's a pleasure to be here, and looking forward to having an opportunity to share some information and entertain and possibly even answer some questions when as the afternoon goes on. So one question that frequently comes up is, why are some communities, particularly Black, Latinx, American Indian, Pacific Islander, and Asian Americans, being encouraged to get the vaccine, especially when those communities have frequently been excluded from lots of elements in the healthcare system as well as greater society? And the reason is hospitalization and death rates are 2 to 4 times higher in communities of color. So with these high rates of hospitalization and death, it is really crucial that we do something to get those rates down, right? So we've been focusing on prevention, and now that we have a vaccine available, we're trying to encourage people to strongly consider taking the vaccine in order to help get these rates down. And this is a picture of Martin Luther King Jr. Hospital in the Compton Watts area. And this was in early January. And it was so full, they had to open this tent here next to the hospital to take care of patients. So that's what happened during the surge. And those are the type of things we want to prevent from happening again. So these are some select quotes from some different participants in some of the sort of town halls and focus groups that we do. The US has never been 100% pro-Black, so why are we getting preferential treatment for a vaccine now? So that's someone who's very skeptical about this. What phase is the undocumented in? Another common question. It kills me every time I see my Lola and I don't hug her. I don't come near her. I don't let her pinch my belly. I see myself as super disrespectful. Okay. For people who've been let down by the system, in the past, I would hope that there was a little bit of compassion and understanding and patience and not treating someone as less than because they're impacted by situations of the past. And then another quote, there's a concern that the long-term effects and not sampling enough Pacific Islanders, women, people of color, those with health disparities, and the time frame of which a vaccine is normally vetted, this is really quick. So it's very scary. And that's the word on the coconut wireless vine, okay? So some of the common concerns that I've heard from many of the town halls and different meetings and groups that we've spoken with is one, mistrust. And that's mistrust based on historic and contemporary mistreatment from the healthcare system. And I think that's a reasonable and legitimate concern. Lack of universal trusted sources of information, right? So there's so many different sources of information and they're so inconsistent. How do we understand, how do we know what to believe, what not to believe? And again, as was mentioned earlier, the vaccine is kind of new. It was created quickly. Did they skip things? And then we heard about these clinical trials, but were people like me a part of the clinical trials? So although the vaccine was created quickly in a sense, these vaccines and the process for doing these vaccines have been worked on for years. And the reason why it was created so quickly was there was a lot of money put into the creation of vaccines through public-private partnerships. And so the vaccines, as soon as they looked promising, they were allowed to go forward and start making lots of vaccine so that if and when it got approved, there would be plenty of vaccines available. And what you don't hear a lot about is there are some vaccines that didn't make it. They didn't get approved. They didn't go forward. But normally, if you're a pharmaceutical company, you're not going to start doing mass production until you're fully approved. And here, they were given money to start mass production even before they were approved. And there was a lot of diversity in the clinical trials. So there's great representation of broad segments of society. But I do want to say that many of the reasons for vaccine deliberation are valid and respectable, and they should be answered by a qualified physician or some other agency. Hopefully, I might be able to answer some of those today. So what are some of the benefits of getting the vaccine? One, it protects you. Two, it protects your family. And three, it protects your community. We've heard that Pfizer and Moderna vaccines are 95% effective in preventing any symptoms of COVID-19. That was unexpected and amazing, right? The flu vaccines are usually 40 to 60% effective. Now the J&J, which is the third approved vaccine in the United States, was 66% effective in preventing any COVID-19 infections. However, it was over 95% effective in preventing COVID hospitalizations and death. And that's what's most important, right? So if you have we'd like to have nothing, but the key is we want to prevent being hospitalized or dying. And actually in the J&J trial, no participant who got the vaccine was hospitalized or died. So that's very important. So all three are really good at preventing that. And that's the only reason why we are where we are now and developing vaccines, closing schools, closing stores is because people are being hospitalized and people are dying. If you're not vaccinated, it increases your risk of getting COVID-19. And we are presently involved in a lot of studies here at UCLA looking at long-term complications that people are getting from COVID-19. And we'll talk a little bit more about that later. So which vaccine is better? They all three do what's really important. Prevent hospitalizations, prevent deaths, right? We can't really compare them. And so the 66% for the J&J, which may appear to be not quite as good, that was also at a time when many of the variants were around. And so the J&J study was conducted when there were a lot of these variants. And what that suggests is, with some of these variants, which have, could be very dangerous, and we hear a lot about these variants, J&J prevented people from becoming hospitalized or dying even when they were tested in areas where the variants were around. So people may actually have a mild case of COVID, but not a severe case. Okay. So I see a lot of things about the talk and conversation about what the vaccine will and won't do. So I just want to say what's not a thing or not true. So the vaccine will not alter your DNA. 5G mobile phones cannot transmit coronavirus. The results were not faked. Importantly, you can't get COVID from the vaccine. Now that's important because a lot of vaccines are attenuated live virus, and particularly if your immune system is not optimally functioning, you get the vaccine, you could in fact get that infection, right? So that's a great question and a great consideration. But with the 3 approved vaccines, they just have a little piece of material, messenger RNA, or a virus that goes in your body and has it make a protein that's part of the vaccine, but it does not, it's part of the virus, but it does not make a whole virus. So you just have a piece of the virus, and then your body develops immune response to a piece of that virus. Lastly, there are no nanosensors to monitor your location. The government already knows where you are. You have a cell phone, you have a smartphone. If the government, Google, Apple, somebody knows where you are already. So they don't need to put it in the vaccine. Okay. The way they work, and I'll talk a little different, but the Pfizer and Moderna, the messenger RNA vaccines, it teaches your body to recognize this material goes in, it creates a protein, and then that messenger RNA gets degraded and disappears like Snapchat. And the protein that's made, that protein is a protein that is on the virus that creates, the body sees that as foreign, creates an immune response, and that teaches your body to be able to attack COVID-19 if you become infected. And to date, there are no long-term side effects that we know of from the vaccines. And they've been out for now, 6, 7 months or longer for many of the studies. What about the side effects? So what I have here is a comparison of the different side effects. So on the right-hand side, we have the flu. And the flu has the least amount of side effects, right? So it's rated number 5 and has the least amount of side effects. The J&J, then COVID from Pfizer, the COVID from Moderna, and then shingles. So shingles has the most side effects. I happen to be vaccinated myself. I got the Moderna. And I guess I was lucky because I only had some local pain at where I had the injection. The second time I might have had a little fatigue, but that was about it. My cousin's husband, he's a little older, he had like everything on this list, okay, and was sick for like a day and a half. And after that, he was fine. So it is, the side effects are real, but the goal is, but that means that your body is creating this large immune response frequently, and so you're having these side effects. But the goal is to have that last for a day or two, fewer side effects if possible, but then after that, now you're more immune and hopefully in a situation that you're unlikely to come down with a COVID infection. So one question a lot of people have is, can I choose what vaccine? So now I'm interested. Dr. Norris didn't sound totally crazy. I think maybe I'm going to go get a vaccination. And can I choose which vaccine I want? And that varies. In conversations with the state, we are trying to make more than one vaccine available at all the sites so that people can actually have a choice. That being said, if you sign up and you get to a site and a vaccine you want, they've now run out of that, you're then left with whatever left over. And my recommendation is between these 3, take whatever's available. But clearly, for a lot of people, I can understand having one dose from the J&J or Janssen sounds very appealing. Some people say, well, I don't, it was 66%. I don't know why it's 66% versus 95%. And what this talk is about equally good for not being hospitalized or dying. I want the 95%, and I don't care if I have to get 2 doses. So people will make different choices. Right? And hopefully we make those available so that you have the chance to make the choice, but it may not always be available when your time comes to become vaccinated. Okay. So I mentioned earlier, there was a lot of diversity in the participants in the trial, including people who are over 65 years of age, including people from a wide range of racial and ethnic groups, and people with chronic conditions like diabetes, high blood pressure, heart disease, et cetera. And so what's important is that it appeared to work about the same in everybody, and that's really good. So if you've already had COVID-19, should you get the vaccine? And the answer is yes. I said, well, I had COVID, I have antibodies, I'm immune now. That's partially true. We're not sure how long that immunity lasts. We feel it's pretty good it lasts at least 3 months, but maybe at 6 or 9 months, it really appears to become less and less. And we're seeing lots of people who had a COVID-19 infection get another COVID-19 infection. And so if you've had a COVID-19 infection and now you've recovered, you're past your quarantine, then we suggest within 90 days, go get your vaccine. Okay. Do you need to wear a mask after you've got the vaccine? So yes, you do. You have, so I have my mask here with me. And when I'm around people, I still wear my mask because there's a small chance that I could get COVID infection and not have any symptoms. Right? It's 95% chance I won't, but there's 5% I will. And what I don't want to do is to then give it to somebody else who then goes home, gives it to somebody in the household, and then somebody gets really sick, right? So what we want to do is try to eliminate the virus from spreading, and hopefully that will get us more quickly out of the different levels of lockdown or shutdown that we're on right now. Will the vaccines protect against new mutations? So we're not absolutely sure about that, but it appears that Pfizer, Moderna, and J&J do protect you against serious COVID, at least if you're exposed to one of the new mutations. So in other words, people may potentially get an infection and may have symptoms, may not have symptoms, but it doesn't appear that people would end up getting so sick that they may have to go to the hospital and even the intensive care unit or die. So that's great. Another question is, how much does the vaccine cost? Doesn't cost anything, right? It's been paid for with your tax dollars. So that's one thing, you've already paid for it. So another reason to consider getting it. So it's been paid for with tax dollars. At a lot of sites, they will ask you if you have insurance, and they will bill your insurance to help recover some of the costs, because they should be paying part of the cost for this pandemic. But you should not pay any additional costs to your insurance company or to anybody else. So if your cousin's friend has a special site where they're doing vaccinations and it's only $50, don't go. Okay? It's not where you want to get it. Find a reputable place. You know, there's lots of health centers, and there are pop-up sites that may be actually in a park, at a community center, at a school, at a church. It should not cost you anything. So what I want to show here is the risks of vaccination versus the risk of infection, because everything in life is weighing the risks of what we do and don't do. So for every million COVID-19 vaccinations, for every million, there have been 2 to 3 serious allergic reactions. There have also been 1 to 2 hospitalizations because of that. No deaths related to that. There have been 1 to 2 deaths per every million that are under investigation as to whether or not it may be related to the vaccination or not. So that's harder to tease out. You can imagine now we've just vaccinated maybe 60, 70 million Americans, a certain number of people, and we started with people that are older and people that are sicker. So a certain number of people in that group die every day with or without the vaccine. And so we have to look to see, is that something that would happen anyway, or does it look like it was due to the vaccine? But look at every million cases of COVID-19 infection. 15,000 deaths for every million cases of COVID infection and 70,000 hospitalizations, right? So you have 15,000 deaths and 70,000 hospitalizations versus 1 to 2 deaths possibly and 1 to 2 hospitalizations. So that's the balance that we're looking at, and it's just something to think about when you're making your decision. So I mentioned earlier, we're starting to see a lot of people with long-term side effects of COVID-19 infection, and this can, some people just have loss of smell, feeling tired and weak, maybe having some muscle aches and pains. What we see more commonly are things such as sort of feeling foggy and losing your memory and not being able to concentrate. And then sometimes there may be inflammation that can affect the heart or other organs. And we saw this one basketball player during the year who passed out on the court and had to be resuscitated. And fortunately, he did well, but he happened to have inflammation around his heart from a COVID infection. Well, what if you have been vaccinated? What can you do? So if you've been fully vaccinated, in other words, you either got your 1 shot of J&J or both shots of Moderna and Pfizer, you can visit with other vaccinated people indoors without masks or without physical distancing. And it should just be a group of people, a small group, right? Not like a big indoor party with 500 people, but you're going over to a neighbor's house, you're going to your cousin's house, and everybody there has been vaccinated, okay? You can also visit with unvaccinated people from a single household who are at low risk for severe COVID without masks or physical distancing, right? So younger, healthier people whose risk for severe COVID would be much lower anyway, that's an option. You can do that. I have not done that myself, but that's, CDC says that's an option. We don't need, if you've been vaccinated, you don't have to quarantine and test following a known exposure if you're asymptomatic, okay? So this is just sort of summarize what are things you can and can't do. You can get together with others who are vaccinated. If you are vaccinated, yes. You can get together with others from a single household who are unvaccinated and low risk. If you're vaccinated, yes. Large gathering with others from multiple households, no and no. Doesn't matter, vaccinated or not vaccinated, not recommended. Visit public spaces without a mask and maintaining physical distance, no and no. Now, this is public spaces crowded. If you're in the park by yourself, that really shouldn't be a problem. But if you're in a supermarket with a whole bunch of people around, that's a public space. No, there a mask is needed. So what are some of the key takeaways? One, there's lots of misinformation in social media and word of mouth. Most importantly, COVID doesn't care what I believe. COVID doesn't care what you believe. COVID does what it's going to do. Communities of color are contracting the disease and dying at higher rates. So regardless of our concerns for the vaccine, people are still getting the disease and dying. And the side effects of contracting COVID-19 is far worse than the side effects of getting the vaccine. So my message is, why would one consider taking the vaccine even if you have mistrust? I would say we want you alive today to help fight mistrust tomorrow, right? We want everybody here. It's important, we want to address it, but we need you here to address it. Now that the surge is down and we're doing better, the numbers are still not great. So during today's presentation, the hour that we'll be here today, 50 Americans will die of COVID and 250 will be hospitalized, right? So it's a lot better than it was. If I gave this talk 2 months ago, it would be 100 Americans died and 500 were hospitalized during this talk. So it's better. It's still a lot to happen just during this talk though. So one more time, why consider taking the vaccine? It was developed because millions of people with COVID-19 infection were hospitalized or died. And the 3 vaccines we have now are great at preventing hospitalization and deaths from COVID-19. So we want to protect our communities and we want to enhance the immunity within our communities. So thank you very much for your attention. And we will go to Q&A and hopefully answer some questions or hopefully we'll get some answers from the audience.
Thank you, Dr. Norris. Yes, we have quite a few questions. Let Dr. Nakamura ask the first one, and then I'll jump in with a couple. And Dr. Nakamura, you're on mute.
I'm sorry, I don't see any questions.
Okay, let me jump in with the first one. Kevin has a question. After, and I think you might have answered this, Dr. Norris, but after he gets the second dose, can he go visit his grandma since she got vaccinated? Absolutely.
And have a great time. Go see her, have a great time. Hug her, spend time with her, and you should be confident and comfortable that she'll be protected and you'll be protected too. But most importantly, she'll be protected because she's at an even higher risk of being infected, and you should be good, both be good.
Great. The next question might be one for me from Oscar. Will we be going back to campus by fall, at least hybrid? And Oscar, we are working on some specific plans for summer and the fall semester. We don't have anything determined quite yet, and we need to still pay attention to what the LA County Department of Public Health orders are. But my hope is that we'll have a lot more activity on in-person activity in the fall semester so that students can come back and take classes in person. I know many students prefer that. We will, of course, continue to have quite a few classes online regardless, because I know that many folks prefer online classes. They also have work schedules and other responsibilities where it just works out better to take classes online. Let's see, the next question, when can we get the vaccine?
So that's a really great question. I believe for California, it will open up to everybody by May 1st. If we're lucky, it may open up earlier, but I think by May 1st. So right now, it's sort of a, if you're over 65, then it's over 60. It's going, I think, maybe going to over 50 years of age, and then it's 50 with a medical condition like diabetes or obesity, and so there's certain risk groups. But hopefully we'll get to the point where it opens up to everybody soon. And I'm hoping, it sounds like it's going to be the 1st of May, but it may even be sooner than that.
And the next question from Oscar, I just got the flu vaccine. How long do I have to wait until I get the COVID-19 vaccine?
So that's a great question. I think it's the same for all vaccines. I think for the vaccines, if you've gotten some other vaccine like the flu vaccine, for some people the shingles vaccine, then it's recommended you wait at least 2 weeks until you get the COVID-19 vaccine.
Let me see, Dr. Nakamura, did you want to catch the next couple?
Sure, thank you. This question comes from Casey McLeod. Not to be rude, but why are seniors vaccinated first instead of students?
Great question. It's not rude at all. It's not rude at all. It's a great question. And I'll tell you why, but then I'll tell you, reason why one would consider that as a very thoughtful question. So in general, older individuals are more likely to be hospitalized or die if they get a COVID-19 infection. So that's the reason why the decision was made to vaccinate that group first. However, one could say, well, there's all seniors are not created equal, right? So there are a bunch of seniors who are retired, home, have a big house, living by themselves. They're not at risk. They're ordering food in. They don't have to go to work and don't have to go out and be exposed. And so so one could say, why are they at the front of the line? And that's a tough question. There's just no way. Ideally, you'd like to say, yeah, that group probably doesn't need to be at the front of the line. But then there's no way we can monitor like what each person's household is and what they're doing, et cetera, et cetera. So students are less likely to be hospitalized or die, but they are more likely to be exposed to the COVID virus and then potentially get it. So that's the balance. But the reason why the decision was made was because of the higher death rate with increasing age. So it's not rude, it's a very good question.
We have another question. When can I get the vaccine?
So in general, if you're a student or, between 20 and you're under 40 years of age, probably, it's going to be, I would say, another month or so, probably another 4 or 5 weeks before the vaccine becomes widely available and you can get it. But, it's listening, it's always on the news, like when they're expanding to the next wave. And then there's a website called My Turn that people can go to, and you can check the information there. And that's also where you can register and sign up to get your vaccine. Or, there maybe there'll be more opportunities at the school. Who knows? That could be a site. Once things open up, maybe that would be an opportunity for people to come to, and get it at school.
Emily Gutierrez asks, how can teens receive the vaccine or when? I believe they're trying to open back up some high schools, and I would hope those forced to go back should be able to get the shot if they wanted.
Yeah, no, another great question. So of the vaccines, there's only one vaccine that's approved for 16 and 17-year-olds, and that's Pfizer. Moderna and J&J, the studies had people, everybody in the study was 18 and above, so it's not approved for below 18. So we have some teens, if you're 16 and 17, that would be eligible. They're not in the queue right now for, but the vaccine's approved for 16 and 17-year-olds. And studies are going on now for adolescents below 16. So I think it's mostly 12 to 16. And then so the studies keep going to younger and younger groups. But right now that's, but we do have one vaccine that will be available for 16 and 17-year-olds. And, you know, that's a tricky question, right? Because we're trying to open up these schools. And so how do we then balance, if you're going to open up the schools, to then try to make it available to students who will be going to these schools. So right now, the students are requested to go to the school and just wear masks, right? So the 3 W's: wash your hands, wear your mask, watch your distance. And so right now, they're not getting the vaccine, but they could sometime soon. Probably again another five weeks or so.
Thank you, Dr. Norris. Great question here from Emmanuel. Dr. Norris, my wife is pregnant, and is the vaccine safe? She is only a couple of months in.
So that is a very good question. So there was actually a report on NPR this morning about a new study that where now they've looked at more individuals who were pregnant and got the vaccine. So when the studies were first done, if you're pregnant or planning to be pregnant, you were not allowed to get in the study. But a lot of women are in the study. It's a pandemic. A lot of people got pregnant. It just happens. It's life. And so what we find now is that of maybe 150 individuals who became pregnant, that there were no side effects, that the antibody response is really good, that it's in the amniotic fluid, which means the babies are probably getting the antibodies and the protection as well. And so it appears to be pretty safe. The other thing is, what we have seen is pregnant women, if they get COVID-19 infection, their disease tends to be much worse. And so pregnant women who get COVID-19 don't do as well. So there again, we have that risk benefit ratio, that the vaccine appears to be very good and with no known side effects. And if you get COVID-19 and you're pregnant, people often don't do very well. And so the recommendation by and large is yes. Usually it's a conversation with your doctor, make sure there's nothing else going on, no other reason why you shouldn't get the vaccine. But unless there's no reason why an individual shouldn't, the recommendation is yes, go ahead with the vaccine.
You answered these questions already, but maybe there's some latecomers. One is it true that there is more than one type of vaccine? And is Johnson & Johnson one-time vaccine as effective as the others?
Yeah, so good question. So yes, there is more than one type of vaccine. So there's 3 vaccines approved. 2 of them are pretty similar. There's different types of vaccines and different ways the vaccines are made. And so some vaccines actually use a small virus, an adenovirus that is sort of something that we're all exposed to all the time. And that virus then goes into the cell and helps to tell the cell to make the protein to protect you against the COVID-19 coronavirus. The other is a messenger RNA, and that RNA gets delivered and it tells your cells to make the protein as well. So there are 3 approved vaccines, but there are actually 2 different types that are approved right now. The Moderna and Pfizer are similar, not the same, but similar, and J&J is a little different. Now the J&J is one dose versus 2 doses for the others. And the question is it as effective? So it appears to be maybe a little less effective at preventing mild symptoms, but we can't really compare that with Pfizer, Moderna, because when Johnson & Johnson was undergoing its studies, there were a lot of variants around, and those are more difficult for any vaccine to help prevent. But we do know Johnson & Johnson is as effective as Moderna and Pfizer in preventing hospitalization and preventing death. And that's what we really want, right? I mean, none of us want to be sick for a couple days, but a couple days, if it's a week, it's a drag. But what we don't want to do is be in a hospital on a ventilator, on a breathing machine. That's what we don't want to do.
Dr. Norris, I'll grab the next 2 questions. The first one is from Leslie. How are we able to know what ingredients are in the vaccine before getting vaccinated? If someone is allergic to a specific ingredient in the vaccine, do they still have to get vaccinated?
Yeah, so to know what the exact ingredients are, you can go online and look it up, right? So you have the information there. And if you're allergic to the specific ingredients, which very few people are, but some people are, no, you don't have to get it, right? So, and they're different, all the vaccines are a little different. So this is not mandatory. It's highly encouraged, highly recommended, but it's not mandatory. So my sister has severe allergies. She uses an epinephrine pen or EpiPen, right? So, and she's allergic to usually like mango, kiwi, some different fruits. And so she was very concerned about it. And so she decided to get the J&J because there she only had to get 1 dose. It actually didn't have, so from the studies, it didn't appear to have a severe allergic reaction. And a lot of times the allergic reaction people get, it just happens out of the blue. It's not like, so some people get it, they didn't have any allergies before, like penicillin. If you have an infection, you get penicillin, you can have it 10 times, the 11th time, you could get an allergic reaction to it. So for people who have severe allergies, my thought is I would go with J&J because I only have to be exposed to a possible allergic response once rather than be exposed to it twice, right? So that's my thought process for that.
I kind of have a question as a follow-up to that. When the vaccines first came out, some of the early data said that there were allergies to polyethylene glycol, which is an ingredient in a lot of commonly used personal care products, and as opposed to the Johnson & Johnson vaccine, which uses the adenovirus for delivery of actually the same messenger RNA, I believe. So is there some new evidence on the polyethylene glycol?
So so for people who are allergic to polyethylene glycol, there would be a greater risk for having an allergic reaction, right? And we see people who've had some types of plastic surgery with different fillers that may have polyethylene glycol. And what they will get a lot of times is a local reaction around where they may have had plastic surgery, and that will last for a few days and then go away. And so sometimes the reactions can be mild and local and self-limiting, but sometimes you could have those more severe, we call anaphylactic reactions, where now your throat's starting to close up and you're choking, and then you have to have epinephrine and really intensive treatment to make sure that nothing serious happens. By
Thank you.
dying.
Back to the queue, I guess. Lyra K asks, which vaccine is safer for those with pre-existing conditions like heart conditions, high blood pressure, diabetes, etc.?
Yeah. So to my knowledge, there's no difference in the vaccines in regards to people with pre-existing conditions. So they were equally as effective and equally safe for people with those different conditions. It's something we will, so what happens now is a continuous monitoring process of collecting information as people are becoming vaccinated, right? So when the studies were done, there are 30, 40,000 people in a study. Well, now we're vaccinating millions of people. And so this is a chance to see if maybe we do see some differences now that we have larger numbers we can look at. But as of right now, to my understanding, and from the studies, there's no difference in safety or effectiveness in people with pre-existing conditions between the 3 vaccines.
Dr. Norris, question from Emily Gutierrez. Is it safe to take Tylenol just before getting vaccinated?
So that's a really good question. The CDC recommends don't take Tylenol or Advil or Motrin before you get your shot. You can take it after. I recommend to everybody, take, if there's, now again, if you have pre-existing conditions, there may be some reason why you shouldn't take one or the other. But I took Tylenol after I got my shots, and I took it for 2 days, right? Because the side effects usually happen over the first 2 days and can last for 2, maybe 3 days. So I just took Tylenol every 8 hours for 2 days after I got my shot.
Thank you. And I'll take the next question and turn it over to Dr. Nakamura for the follow-up to this one. This is from Emmanuel. My dad took the vaccine. The first one felt a little funny, and then took a second one later on that morning. He almost got called off of work. Is that normal? So it sounds like there's a much bigger reaction at the second dose. And is there a way to better prepare for a second dose where the reaction may be stronger?
Right. So great question. So it's hard, it doesn't always happen, but it's more likely to have a more severe reaction after the second dose, right? And why is that? Well, now you've had the first dose, your body has an immune response. Now you get a second one because we want to make it even stronger. And so it means the vaccine is working, right? It's making your immune response even stronger. But the side effect of that is you get even sicker. So there's really not a good way to prepare. The best way to prepare is take the vaccine on a day where you don't have to work the next day, right? And then take Tylenol right after you take the vaccine and take it every 8 hours. And that should help minimize the side effects. And if you do feel pretty bad, if you've taken it and you're not working that next day, then that gives you a chance to recuperate without having to lose work.
Yeah, that sounds great. Sounds great. Kind of reminiscent of the hepatitis B virus vaccine, where you need 3 shots to really kick up your immune response with repeated exposures.
Right.
Here's a question from Tracy. What are the implications of the many students on our faculty who may not or will not be vaccinated, and for various reasons, when we start going back to campus?
Right. So great question. So the implication is continue to wear your mask, wash your hands and watch your distance, right? So we can do prevention, preventive medicine, preventive measures. And, as more and more people take the vaccine, and therefore the spreading of the virus gets less and less, it will also start to protect people who are not vaccinated, right? That's what we call herd immunity. And so that's, as we sort of had this conversation today, we know everybody's not going to take the vaccine, and there are legitimate reasons why some people may not want to take it. And there are, let me take that back. For each person, it's legitimate for them, right? It's not for me to say your reason is or is not legitimate. It's for me to say, I feel you now have good information, and you now have to make the decision when you weigh your risk of taking the vaccine, its impact on you, its potential impact on your family, its potential impact on your community, versus your desire not to take it and your concerns. And you make that decision. But hopefully we will have enough people who are comfortable in proceeding with the vaccine. And then when that happens, we should see the vaccine, the virus start to go away, the number of infections go away. But until we get to that point, we have to do the preventive strategies, which is wear your mask, wash your hands, watch your distance.
Thank you. The next question is related to this one from Emily Gutierrez. How can we continue to protect ourselves if we can't enforce persons getting the vaccine and can't ask them for proof of vaccination due to HIPAA laws?
Right. Again, another great question. So the only thing we can do is wear a mask, wash our hands, watch our distance. We want to sort of, make decisions around where we go and who we hang out with and who we allow to visit, things of that nature, right? So if you have people who want to come visit and you have babies in the household, or new babies, or you have elders in the household and they want to come visit, but they don't want to wear their mask and they don't want to tell you whether or not they're vaccinated, or you don't trust them, then don't have them come over. And so those are just decisions you have to make. And, you tell them that it's nothing personal. I'm just making sure, I just have to do everything I need to do to protect my family first and foremost. And once the pandemic's over, happy to have you over and happy to get back together again.
Emmanuel asks, with the high flow of money, how do we know we didn't just fatten the pockets of big pharmaceutical companies over our own health? And how are we 100% sure that we did not just make their stockholders richer?
So there was a lot of money flow and a lot of them got rich. That's probably just a true statement. The question for us is, we actually have a vaccine that works, and there are a lot of companies getting rich over things that don't work. So we could argue over how much money a company should or should not get. And I agree that, there should be, some balance in society. But right now we have an opportunity to have access to vaccines that work, that we've already paid our money for, right? So we're not being charged again. We've paid our money as part of our taxes. So from my perspective, if we don't take the vaccine, they're just going to take it and sell it someplace else and make even more money. So actually you'll make them richer by not taking the vaccine. So if you want to cut down their profits, take the vaccine.
Dr. Norris, the next two questions are an interesting pair, and I'm going to ask them together because it's an interesting combination. The first one from Casey, Dr. Norris, why do people think COVID is fake and think the vaccine has some government stuff inside? The next question from Margaret, why is the media censoring adverse reactions? Why hide the truth? VAERS has many reports of deaths and serious injuries, and there will be no compensation from the drug companies if you're injured.
Yeah, so I'll start with the second one first. And the issue around vaccines and exemptions from injury for drug companies is a big issue. It's a big concern, and it's not new, right? So this is not new for COVID. This sort of limited or lack of liability for vaccines is pervasive for almost all the vaccines. I'm not a vaccine specialist, but it's pretty wide. So that's a concern. The reactions, there are a lot. So there are reports. The CDC keeps a record of a lot of the adverse events and the deaths. But as I said, we have started the vaccinations in people over 65 years, over 75 years of age with multiple medical problems. And for every several million, there are going to be a certain number of deaths when people get soda, coffee, juice, or vaccine, right? And so there will be deaths with people who've gotten the vaccine. The question is that any different than people who just read the newspaper that day, right? And then 2 weeks later, somebody died. And so most of the analyses are to do that comparison. And so it's not necessarily, so yes, there's a concern about hiding the truth, but there's also a concern about getting misinformation out, right? And so if you have if you only have part of the information and it's in a biased way, then it can give the impression that there are problems occurring related to the vaccine that's not related to the vaccine. Now, I know there have been some recent reports about increased numbers of blood clots related to AstraZeneca in Europe. And so that's led to some concerns. Now, I know there's a recent report on data, I think it's AstraZeneca from sites in the United States where they didn't find that. But again, a lot of times there may be a side effect that occurs not that frequently, and you can't pick it up when you only study 30,000 people. But when you get to 2 or 3 million or 4 or 5 million, then you may see that side effect, right? And so it is important that the media presents that data and make sure that people are aware at least of the potential concerns. And then we have to hold the medical community accountable for doing the appropriate analyses to see if these are higher rates of occurrence in people who got the vaccine versus the general population. And so that's a key thing there. But yes, we don't want adverse reactions hidden, but we don't want to scare everybody with information that's wrong. And then why do people think it's fake and has some government stuff inside? A lot of people just don't trust the government, right? So, and because there was government co-funding with some of the vaccines. Now, actually, Pfizer did not get government funding to develop their vaccine. They developed their vaccine without any government funding. I think they may now have government funding to help increase the production, but they did not get any government funding to develop their vaccine. They started early on and did theirs independently. They may have I'm not sure, they may have gotten some money later on, but they did not develop theirs with government funding. So it's separate, and yet it's pretty much the same finding that we have with Moderna. But no, I remember I had a study patient for, I do actually more in high blood pressure. And I told him, I said, you know, we have this study and we're comparing two types of medicine for high blood pressure, but it's not a placebo or sugar pill. They're actually both high blood pressure pills. We just want to see which one works better in patients with kidney disease. And he says, no, Dr. Norris, that's not my question. I believe you about that. What I want to know is, how do you know what the government put in those two different pills? Right? How do you know? And I was like, you know, that's a great question. I don't know. I said, but when I go to the pharmacy, I can't say I know what's in there either. Right? So, you know, at some point we have to have some faith that people do the right thing. And we see that. We've seen it with cancer medications where some pharmacists have tried to cut the dose down so they can make more profit. And that's been very dangerous for people who were supposed to be getting their cancer medicine. So, you know, as a society, we just have to learn and hopefully promote more responsibility and to try to hold each other accountable to be as responsible as we can to do the right thing.
Dr. Norris, I think I'll jump in if you don't mind, Larry, and pick up the next question. It might be one more for me. The question from Eric, is there a possibility to hold an in-person graduation for spring with the rates of COVID-19 going down now? I'll start the answer, and Dr. Norris, if you want to jump in after I do.
Sure.
But our plans currently are to have the graduation this year to be virtual, similarly to last year. So we don't have plans to have graduation this June in person. And the reason why is we just don't feel that it's advisable to have several thousand people all gathered together in one space. It could be that in a few months, the situation improves so much that it would have been okay. But we have to go ahead and start making plans now for graduation and preparing the ceremony. So we're going to go ahead and hold this year's graduation virtually. Hopefully, this will be the last virtual graduation for some time, but that's our current plans. Dr. Norris, what's your reaction to our plans for virtual graduation?
They sound perfect to me. That's, you know, I don't know of any place, any school that's having an in-person graduation this year. And so they're all virtual. You know, the rates are going down. That's great. We want to keep them down. And so it's probably going to be a few more months and probably into the fall, where we're really getting to the chance to maybe do something. And as you mentioned, you know, you're looking at probably a hybrid approach to even school in the fall. And we're probably looking at the same, the last I've seen, that's what UCLA is looking at as well. So I think it's you know, I know everybody wants to get out there and get back to normal, but it's not safe yet. So we still have to be cautious.
Steph wants to know, can you take the vaccine while breastfeeding and a newborn?
So yes, you can. And now there's some suggestion that through breastfeeding, the newborn may be able to get the antibodies from the vaccine. So they maybe get the protective antibodies from the mother through breastfeeding. So that's something that's being looked at now, but it looks like that is actually true. And the recommendation is that it's okay to get the vaccine while breastfeeding.
A great question here from Gabriella. How long is vaccine good for? Is the vaccine a one-time vaccine, or should it be done every year?
That's a great question, Gabriella. I wish I knew the answer to that. I'm going to say this. Based on the early findings from people who got infected with COVID and the antibodies not lasting that long, I first thought that we were looking at probably every year. But the antibody response appears to be really, really, really high with the vaccines. And so I think there's a good chance that it could last longer for a year, could be 2 or 3 years. But we don't know yet. The other concern is some of these variants. Right, so we keep hearing about these variants, the United Kingdom variant, the South African variant, the Brazil, and then different places we have Southern California variant. And some are more dangerous than others. Right now, it looks like at least we're able to prevent severe infections from the variants with the vaccines we have, but there may be sort of new vaccines modified a little bit to be more directed to protect against those variants. So that could be what the boosters may look like. My hope is that they're lasting for more than a year, 2 or 3 years. That would be amazing.
Dr. Norris, we've gone over an hour. We have a couple more questions. Do you have time for just a couple more?
Absolutely.
Wonderful. Let me turn over to Dr. Nakamura for the next 2 questions.
Amanda asks if there's a difference in terms of safety, long-term effects of the mRNA versus DNA vaccines.
So right now, the safety appears to be the same between them, right? So we don't have a lot of long-term data, but it appears to be the same. And so we just go with that. So that's something that will continue to be looked at. Usually, vaccines side effect, particularly in adults, but even in children, if there are potential side effects, usually they're reported to occur early on. Now, some of the childhood vaccines, that's another more contentious area where there are concerns of people under 3 getting vaccinated for mumps, measles, and rubella, and potentially having side effects if it's done too early or if the dose is too high, leading to side effects such as autism, and that's a very contentious area. But usually those side effects are observed early on. So we really haven't seen that in those types of side effects, at least in many of these, in the COVID and many of the sort of adult vaccines. There have been some reported cases of some sort of immune reactions where the body, just like if you get so some people who get COVID may get a very severe reaction because the body has this big response to it. And so if it can have a big response, so if you get a similar response to the vaccine, and it could have a reaction that could be more severe. And so those are the types of side effects we've been looking for, and there have been a couple cases reported here and there. It seems to be pretty rare, but it's something we have to keep looking at.
Thank you. This last question is really great, from Shoshana. If we are vaccinated and our children are not, if we are exposed to COVID-19, what is the risk we will infect our children?
So great question for ending up here. So if you're vaccinated and your children are not, the chance that if you get exposed to COVID, that you would infect your children is still very small, because now you're vaccinated, your chance of getting COVID is very, very small. Could happen, but it's very, very small. And so that's a really good thing, right? Especially since the children are not, depending on their age, may not be eligible, or there may not be an approved vaccine for their age yet, or they may not be eligible for the vaccine yet, but their chance of getting it from you as a parent or another member in the household who is older and is vaccinated is very, very low.
Dr. Norris, again, I want to thank you for joining us this afternoon. I know we went a little bit long, but we greatly appreciate your presentation. It was exceptionally informative. I know I learned quite a bit. I know it was a great value to our campus community. And Dr. Nakamura, thank you for joining us as well. It's always a pleasure to spend some time with you.
My pleasure, my honor.
And I also want to give a shout out and thank Tanya Sirkin and Brian Melblom for their behind the scenes support.
Absolutely.
And of course, thanks everybody for joining us and watching. And of course, stay well and be safe. Thank you, everybody.
Thanks so much and pleasure to be here.